So good afternoon, everyone, and welcome to the Business Reopening Workshop featuring Ottawa Public Health and Bylaw and Regulatory Services. Thank you so much for joining us today. My name is Lynn Ladd, and I am the Director of Organizational Advancement with the Ottawa Board of Trade. And before we begin today's session, I want to let you know about a really exciting initiative that we're involved with the Ontario Chamber of Commerce and at the local level, with a number of partners, including Invest Ottawa, Bayview Yards, OCOBIA, of course, and RGA. And through the Ontario Chamber and the Ministry of Health at the provincial level, we are distributing rapid antigen testing kits to businesses in the Ottawa area. We're really excited to bring this to you. The purpose of this program is to provide businesses with just one more tool in their toolkit to help curb the spread of COVID-19 in Ottawa. So this is not intended to replace physical distancing. It's not intended to replace the need for vaccinating as many people as possible. It's just one extra layer of protection for our Ottawa businesses to help them stay open, to protect your workforces, to give what clients and visitors that you might have at your business confidence that you're operating in a really COVID safe manner, and to help identify asymptomatic carriers and get them isolated and properly tested before they return to the workforce. My colleague Melissa is going to post a link in the chat for you if you'd like more information. These kits are free. There is no obligation for payment or anything like that. It is simply a program to help all of the businesses in the Ottawa area. You do not need to be a member of either the Ottawa Board of Trade or OCOBIA. And so we'd like you to feel free to participate in this program, and I hope that you'll find it beneficial and helpful. So at this time, I would like to call on my colleague, Michelle Grew, the Executive Director of OCOBIA, to say a few welcoming words.
Thank you, Lynn, and thank you to the Ottawa Board of Trade for your leadership as we navigate through this. We're happy to partner with you on this and many other projects that serve our business community. This session was kind of like a seed planted in a meeting. You know, Roger from Ottawa Bylaw was there, was with the Canada Central BIA members. You know, Laurie Musa, who's the executive director there, had some members together that were just asking about restrictions and regulations that were happening. Obviously, being open and shut and open and shut, there's been a lot of changes as we go along. So this type of session came up, and her members, Ilon and Abbas from Drama Bar and Grill had wanted to convene, and we had talked about a session like this. So I'm really glad to see it come together, especially with Bylaw and Ottawa Public Health in the same meeting. So this is wonderful. I wanted to thank everyone for your endurance and tenacity during this. There's someone who's not on mute.
You're muted.
Sorry, Michelle, that was me. I unmuted you by mistake.
Oh, hello?
Yeah, sorry about that, Michelle.
That's okay. So I'm just going to hand it over to Ottawa Public Health and Ottawa Bylaw. Our speakers today are Jenny Queen from Ottawa Public Health and Kayla Woods from Bylaw. So thank you so much. Enjoy the session.
Thank you very much. Good afternoon, everybody. Today's session is designed to assist businesses in Ottawa develop a safer return to service and operations within the provincial 3-step roadmap. We welcome and thank you for your interest in today's session. We appreciate your continued commitment to safety, and we understand the challenges in navigating the pandemic as business owners and operators. Today, we'll hopefully provide you with some key information to help you develop your return to operations within the provincial roadmap and reopening. We would like to begin first by honoring the Algonquin and Anishinaabe people on whose traditional unceded territory the City of Ottawa is located. We extend this respect to all First Nations, Inuit, and Métis people, their elders, their ancestors, and their valuable past and present contributions to the land. This presentation, as you know, has been developed by Ottawa Public Health and our bylaw and regulatory services colleagues. We would like to also, of course, recognize our hosts today, the Ottawa Board of Trade, the Ottawa Coalition of Business Improvement Areas, and Regroupement des gens d'affaires de la capitale, nationale. On our call today, I'm being joined by Kayla from Bylaw and Regulatory Services, along with some other panel members who will assist in the Q&A following today's presentation. Our agenda today, we will be discussing some of the lessons learned in our previous reincarnations of reopening, safety plans, provincial guidance and regulations, some public health measures, and of course, ending with a Q&A. We know that many of you and many others are eager to resume business. We also recognize the challenges local businesses have had and continue to face as a result of the pandemic. It's important to note that the provincial orders set out what is permitted or restricted, and that OPH will continue to provide guidance and support for safe reopening of businesses, while our colleagues in bylaw and regulatory services will continue to support with the interpretation of those regulations and, of course, any enforcement aspects. With reopening, there's no such thing as zero risk. Although vaccination is well underway, public health measures will need to continue for quite some time. Again, remember that the province has the authority to change what and when activities are permitted. The more interactions that we have on any given day certainly increase those risks or the potential risk of transmission within your workplaces as well as within the community. So although there is a high eagerness for returning to normal, we do need to collectively commit to proceed with caution. So our goal is to focus on reopening our settings in as safe a manner as possible. And to support you with that, we have various guidance documents and resources that will continue to be available on the Ottawa Public Health website. Please note that some of those guidance documents will of course need some updating as we receive more information on the current regulations for the various stages. Today's actions are going to impact tomorrow's reality. We know that COVID doesn't take a break, so neither can we. We each have a role to play if we want to keep our businesses open and progress towards our thriving economy. We want to support the community immunity by getting vaccinated, encouraging vaccination with your employees, and continuing to follow those public health measures. You can support your businesses by supporting your employees, making sure you have quality employee safety protocols, implementation and ongoing evaluation of your safety and operational plans, and continuing to ensure daily screenings. Safer reopening is key for us in preventing and delaying the transmission of COVID-19. And again, everybody is going to play a role in building up that thriving economy, which we recognize is good for public health. Before we start to look forward, it's important to reflect on the successes as well as some of the challenges of our past reopenings. In previous reopenings, we saw incredible community support. Ottawa is a wonderful place to live, work, and play. We also witnessed the commitment of business owners and operators such as yourselves, who were willing to learn how to navigate throughout this pandemic. The lessons learned provide us with insights on how we can avoid the spread and transmission of COVID-19 within our businesses and within our communities. The first step is knowing and understanding our blind spots. and we all have blind spots. These are the places where we tend to let down our guard because we're most comfortable. In the work environment, these blind spots have been employee break or lunchrooms or employee only areas, and activities that employees are participating in both before and after work schedules. We can also learn through cases, and we saw cases in all sectors of workplaces, in restaurants, corporate offices, health settings, retail settings, service, sports, warehouses, and distribution. The transmission that was work-related was often attributed to a lack of public health measures in those staff-only spaces, such as those lunchrooms that we were speaking to earlier, or before and after work activities, and an example of that would be carpooling. We need your help in understanding these cases and outbreaks, and to do that, your reporting of workplace cases is a key step in helping us inform best practices and supporting you along the way. Your business perspective is so important. You know your operations best. Take the time now to start to assess the implementation of your previous return to operational plans and safety plans. Assess what lessons you learned in the previous reopening periods. What worked well for you, for your businesses, and for your employees that you want to keep? And what didn't serve you, now is a good time to change that. We also learned some lessons from provincial and local inspections, which noted some key areas were often missing in workplaces. Safety plans, not necessarily being available, up to date, or current. Daily screening of staff and patrons, and employees following those protocols, including wearing proper PPE. When we talk about safety plans, you as employers, business owners, and operators are required to have a safety plan that is available upon request, and we highly recommend that you review it and update it regularly. There's a checklist and a text file template of the safety plan available for download at the provincial website, and links will be available in the chat to make it easier for you. A different approach that perhaps you've heard before when taking a look at developing safety plans is to use the acronym RACE: recognize, assess, control, and evaluate. Recognize the areas of risk where transmission or possible transmission may occur in your workplace. Assess the level of risk. Next, we put in those controls, policies, procedures, practices, or protocols to eliminate or reduce the spread or transmission of COVID-19. And the next big, really important step is to evaluate. How is your plan working? How are the controls working? Adapt as needed. Prevention measures will continue to stay the same to reduce the spread and transmission of COVID-19. Screening of employees and patrons. Maximizing that physical distance and separation by installing barriers such as plexiglass to enable your workers to maintain physical distancing of at least 2 meters. Scheduling staff around shifts to ensure the number of people in the space is reduced as much as possible, especially during lunch or breaks. Masking. All staff are required to wear a mask while at work. Customers are also required to wear masks, an exception being when they're eating or drinking. Reducing transmission from surfaces and objects, supporting good hand hygiene, personal protective equipment, determining what PPE, personal protective equipment, is needed in your workplace, and ensure consistent supplies are available for your employees. And vigilance, before, during, and after shifts, those public-facing staff, as well as in staff-only spaces and on breaks. COVID doesn't take a break, so we can't either. We need to keep up with those practices. Here's something that's new for you. The selection of masks, either personal protective equipment, must be based on the project or workplace risk assessment. But the Ministry of Labor, Training and Skills Development has added a requirement that for any employee working within 2 meters of others, either indoors or outdoors, are now required to have eye protection and an appropriate, which in many cases will be a medical mask. So this may require moving from a cloth mask or face covering to a surgical or medical mask in your work environment. Employers and workers need to select the appropriate mask based on the circumstance where the people are working within 2 meters of each other. For eye protection, this may include goggles, safety glasses, or prescription glasses with side shields that are tight fitting. Should also be selected on the base of your risk assessment. This may mean that for some of your business operations, if you have employees that are traveling from one location to another in a company vehicle of some kind, that your employees will need to have eye protection and masks while doing so. For operational safety, as you are preparing for your safe reopening, businesses should continue to follow the COVID-wise and preventative measures in place because they work. When developing your plans for operational safety, you can consider 3 Ps: people, processes, and performance. When we're looking to create operational safety, your people are your employees, your patrons, clients, or guests. For process, your operations already have a number of roles, routines, and processes at play. Carefully examine each of those to develop your reopening plan. And remember to check in on the performance of how well your plan is working and how well your people are following your plan. Evaluate how everything is going so that you can adjust or be responsive as needed. The 4 key principles are the basics of infection prevention and control remain the same. Adapt your physical space, protect your employees and volunteers, protect your customers or participants, and support any vulnerable clients or staff. You know your businesses and activities best. The best plan is one that is evergreen. It's always being evaluated and able to evolve. For ongoing information to support you, we have a community newsletter which provides weekly summaries and information specific to businesses, and we would encourage you to sign up. Staying informed is another important responsibility for business and owners and operators, and we again thank you for sharing your time with us today to participate and get involved and informed here. Being aware of the provincial announcements and regulations, any local orders, instructions, and information in newsletters, along with the many available tools and resources to your business. We understand that there's so much information out there and it can be really challenging to navigate at times. So always remember, when in doubt, reach out. We're here to support you. The layers of safety measures will help you create better protection for your employees and your clients. And it really truly begins with your workplace's safety culture. Starting with your employees, we would recommend a system of reporting concerns and sharing and offering suggestions for improvements. Building in some ownership will build confidence and engagement with your staff. Encouraging healthy behaviors before, during, and outside of the work environment will also help. Consider having safety officers. Delegating a staff as a safety officer to regularly observe and audit the protocols as well as adherence is a great best practice. Safety plans. We've said it before and I'm going to say it again. This is a great time to review and revise your plans. And again, remember that cloth masks may not be suitable as PPE based on the Ministry of Labor, as they have limited the use of cloth masks within the workplace to employees who are unable to maintain that 2-meter distance or who have a protective barrier. In those instances where you have a barrier and you can maintain that 2-meter distancing, cloth masks can be used. For all other instances where you cannot maintain physical distancing and there is no protective barrier between employee to employee, then you require medical masks and eye protection. Rapid antigen testing or rapid testing is available for asymptomatic individuals who are part of a workplace or setting that is participating in the provincial program. And you learned a little bit more about Ottawa Board of Trade's initiative. Rapid testing continues to be an excellent additional public health tool that can be used in workplaces. Ottawa Board of Trade is of course making this available to you and other small businesses. For information, you can work with Ottawa Board of Trade or check out the Ottawa Public Health webpage for more information. Workplace safety measures for staff and for everybody. The reminder here is, as per the letter of instruction, please continue to ensure that there is adequate physical distancing of workers throughout your workplace. Utilize physical barriers where possible, along with setting capacity limits for patrons, and post a copy of the maximum capacity where everybody can see it. Ensure that you continue to be COVID-wise, especially in those staff-only places, as we know this has been one of our blind spots in the past. Everyday actions matter. Consistency in COVID-wise practices protect you, your colleagues, and your patrons. Screen and monitor for symptoms, physical distancing, understanding the new mask requirements, and eye protection, and of course, good hand hygiene. Business owners still have that requirement to post signs at all entrances in a visible location that informs individuals how to screen themselves for COVID prior to entering your premise, and to actively screen every person who works at your business or organization before they enter the premise. Ensuring that your employees, volunteers, and external contractors are fit to work, in that they have completed that health screening questionnaire before each shift. Again, if someone has symptoms, the next steps would be for them to self-isolate and get tested. They would need to continue to isolate until they have received their test results. And the subsequent steps would be dependent on those test results. It is important that you as employers have a plan in place to quickly respond if a worker or patron has been exposed to or confirmed positive for COVID-19. Patrons or workers who become unwell while at work should be instructed to immediately separate themselves from others. They should be told to go home immediately, if possible, with private transportation, avoiding taxis, ride shares, and public transit, and encouraged to get tested. With vaccination, here are some key tips for screening when vaccinated. You are going to continue with the daily COVID-19 screening of all staff post-vaccinations. Employees can come to work after getting their vaccine, even if they screen positive for the following symptoms within 48 hours of getting their vaccine: headache, fatigue, muscle ache, or joint pain. If these symptoms are mild, only began after vaccination, and the employee feels well enough to work, they can continue their shift. We are excited to announce that we have a new web form to help you with reporting cases. New online reporting tool to report COVID cases in the workplace was designed to support businesses in reporting COVID outbreaks within the workplace. OPH has developed this reporting tool because employers must immediately notify OPH when they become aware of 2 or more people in their workplace who have tested positive for COVID-19 within a 14-day period, as noted within the letter of instruction issued by Dr. Etches. The reporting tool, in addition to the employer protocol when a staff member tests positive, and the high-risk contact letter for staff, are all resources to help support workplaces to take further action to keep your workers and customers safe from COVID-19 transmission. More information on this and how to keep your business safe from COVID-19, please visit Ottawa Public Health's Businesses and Workplaces webpage. As owners and operators, you all have a key role to play. And some of your roles and responsibilities are continuing to stay informed, prioritizing safety first, communication with Ottawa Public Health, ongoing communication with your employees and patrons, and health and wellness supports for yourself and for your employees. I will now be passing it over to Kayla for the roadmap to reopening and the 3-step approach highlights.
Hello, everybody. So the province announced their new roadmap to reopen, which is a cautious 3-step plan that will guide a safe and gradual reopening of the province and the lifting of public health measures based on the province-wide vaccination rate and improvements in key public health and health system indicators. Public health and workplace safety measures would continue to apply across all of the steps, including maintaining physical distance, capacity limits, wearing face coverings in indoor spaces, and whenever physical distancing cannot be maintained. So the roadmap to reopen outlines 3 steps to easing public health measures, guided by the following principles. Step 1, which is anticipated to begin the week of June 14th, has an initial focus on resuming outdoor activities with smaller crowds, where the risk of transmission is lower, and permitting retail with restrictions. This includes allowing outdoor gatherings of up to 10 people, outdoor dining with up to 4 people per table, and non-essential retail at 15% capacity. Step 2 further expands outdoor activities and resumes limited indoor services with small numbers of people where face coverings are worn. This includes outdoor gatherings of up to 25 people, outdoor sports and leagues, personal care services where face coverings can be worn and with capacity limits, as well as indoor religious services, rites, ceremony gatherings at 15% capacity. So step 3 expands access to the indoor settings with restrictions, including where there are larger numbers of people and where face coverings can't always be worn. This includes indoor sports and recreational fitness, indoor dining, museums, art galleries and libraries, as well as casinos and bingo halls with capacity limits. Please note, however, that at this time, we do not have the specific regulations for the 3 steps. Unfortunately, we will not know the specifics of each step until the regulations are released by the province. So the province will remain in each step for at least 21 days to evaluate any impacts on key public health and health system indicators. If at the end of the 21 days, the following vaccination thresholds have been met, along with positive trends in other key public health and health system indicators, then the province will move to the next step. So for step 1, this means that 60% of adults will be vaccinated with 1 dose. For step 2, this means that 70% of adults are vaccinated with 1 dose, as well as 20% vaccinated with the 2 doses. And for step 3, this means that 70 to 80% of adults are vaccinated with 1 dose and 25% have been vaccinated with the 2 doses. So to provide an overview of a couple of the sectors, we'll first go into the retail sector. This is just a snapshot of what we can expect until we get the actual regulations from the province. Before step 1, where we are currently, 25% capacity for retail with other restrictions for some essential retailers. For example, restricted hours, by appointment only. In-store shopping at discount and big box retailers are limited to essential goods, and curbside pickup or delivery for non-essential retail, as well as restrictions on shopping malls. For step 2, this means that essential retail can operate at 25% capacity, selling all goods, which includes discount and big box stores. Non-essential retail will be able to operate at 15% capacity. Retail stores in malls will continue to be closed unless they have a street-facing entrance. For step 2, essential retail will be able to operate at 50% capacity, while non-essential retail would be able to operate at 25% capacity. And for step 3, essential and non-essential retail will open with capacity limited to permit 2 meters physical distancing. So the next sector is the restaurant and bar sector. Again, just a snapshot of what we can expect until the regulations are released by the province. Before step 1, where we are currently, restaurants and bars are open for takeout, drive-through, and delivery service. When we move into step 1, that will mean that outdoor dining will be permitted with 4 people per table, among other restrictions. Step 2, outdoor dining will be permitted with 6 people per table and other restrictions, and karaoke will be permitted outdoors with restrictions. For step 3, indoor dining with capacity and some other restrictions. Outdoor dining with capacity limited to permit 2 meters distance. Buffets will be permitted, as well as karaoke with restrictions. And the final sector will be the personal care sector. As of right now, before step 1, personal care sectors are required to be closed. In step 1, they will continue to be closed. However, sensory deprivation pods will be permitted when prescribed by a regulated health professional. In step 2, they will be able to open at 25% capacity to a maximum of 5 people. It will be an appointment-based, and services that require the removal of a face covering will not be permitted, and only patrons being served will be allowed in the setting. And finally, for step 3, they will be able to open with capacity limits to permit 2 meters physical distancing with other restrictions. Thank you.
So we're going to move into some final thoughts and some next steps with the next few slides. Ottawa Public Health, again, really truly appreciates all of your effort that your businesses have put into preventing the spread of COVID-19 in our communities. We do not know when we will be able to freely enjoy life after COVID-19. But the Canadian government, Life After Vaccination, and the Ontario Roadmap to Reopening have provided some information and structure for understanding the likely progression throughout the summer and into the fall season. As Kayla shared, we are still waiting for the detailed regulations to be more clearly understand the guidelines for each sector within this 3-step approach. What we do know is that we are 1 step closer as we continue to vaccinate against the virus and working towards our greater community immunity. Until then, we must stay the course, follow public health measures, and do our part to keep community transmission and rates of COVID low. Our goal, of course, is community immunity, and you can help us. Each person who receives their COVID-19 vaccine brings us 1 step closer to community immunity. Please book your vaccine appointment as soon as you are eligible and supply allows, the vaccine will not only help protect you, but those around you. Getting your COVID-19 vaccine also reduces your chances of becoming seriously ill, becoming hospitalized, or dying from COVID-19. Why you can, or why you should promote vaccination with your employees. Consider promoting vaccine and vaccinations in your workplace to reduce your employee absences due to illness and ensure sustained workforce productivity. Keep your workforce healthy by preventing employees from getting COVID-19, and it will boost your workplace morale. Remember that until enough people are fully immunized against COVID-19, we must still respect public health guidelines and protect ourselves and others. Even those who have received the vaccine will need to continue to wear a mask, wash their hands often, practice physical distancing by staying 2 meters apart. By practicing these measures, you will help drop the level of COVID-19 within our community as quickly as possible and maintain it. In closing, we appreciate the challenges in adapting your businesses for COVID and are here to support you. When you develop your COVID-19 workplace safety plan, it will only be as strong as your weakest link. Please focus and place an emphasis on your daily screening and vigilance in your staff areas. Please continue to stay informed and use your resources and be COVID wise. It will help you create a safer reopening experience for your staff and your patrons, which is good for business. Thank you again to everybody involved in today's session, including our hosts, and to each of you for sharing your time with us. Stay the course, stay safe, and be well. We will now progress into the questions and answers, which Lynn, I believe you are going to moderate for us.
I am, yes. So Jenny and Kayla, thank you so much for your presentation. We'll dive right into the questions because there are quite a few. So the first question is, since we are tentatively scheduled to reopen on June 15th at 15% capacity, what is the discussion about allowing only those who have been vaccinated in order to enter their store? This is very concerning for me since I do not want to have those not yet vaccinated shop in store. Kayla, maybe you could take that question.
It would be helpful if I unmuted myself. Yeah, so that would, need to be a provincial decision. So it would have to be something that would be required by the regulations when they come out. However, businesses do have the authority to put in place more stringent policies and rules. So really that could be a business decision. However, all other laws and human rights would need to be respected as well.
Thank you, Kayla. Our next question, I'm not entirely sure what they're asking here, but I'm going to put this one to Jenny. It's, will a shield and mask qualify? And that question came from Brio, and if they're still on the call with us today, maybe you'd like to unmute and clarify what information you're looking for.
Yes, I'm still here. So we do a lot of shoe fittings and bra fittings, so we obviously can't maintain that 2 meters when we're trying to fit someone. In the past, we've used a full face shield, the clear face shields with a mask. And you mentioned initially that it was a goggle or safety glasses, but would a shield be essentially the same?
Great question. Thank you so much for, you've got a couple of things at play. From a public health mitigation standpoint, what Ministry of Labor is aiming for, and their language is around when employee with employee cannot be maintaining that physical distancing and there is no barrier. They are looking for, again, that medical mask and eye protection. For that eye protection, they're looking for something that doesn't have the ability for air particles, COVID virus, to get anywhere near the ocular area. So your shields don't provide the same level of protection that a full goggle would provide.
Okay.
So I would suggest that for further detail, for the nuance between an employee and a client or a patron, a best practice would be a goggle over a face shield for that next level or layer.
All right, thank you.
Excellent, thank you, Jenny. Next question. Is the eye protection and medical grade mask required for an office setting? Staff all have their own workspace, but may leave it to go to talk with one another and for more details.
So yes, based on the Ministry of Labor's new requirements, they would require having the medical mask as well as that eye protection in any work environment that is indoors or outdoors where the employees do not have a physical barrier and are not able to maintain that 2-meter physical distancing.
Thank you, Jenny. The next question, I'm actually going to add on to it. One of our guests has asked, is the rapid testing accurate? And I think they want to know to what percentage. And then maybe you could just quickly elaborate what happens if there's a positive test result. Maybe Crystal can take that if Crystal's on our call.
Hello, I'm here. Can you just repeat that question? You caught me off guard, Lynn. Sorry.
Oh, sorry, Crystal. One of our guests wants to know if the rapid testing is accurate and to what percentage. And then maybe if you could take a moment and elaborate what would happen when they get a positive test result in their workplace.
Sure. So I'm going to answer the latter part of that first. So if positive, it's called a presumptive positive test, is received from a rapid test, that individual would have to go home, isolate, assuming it's a positive test, and then get testing at an assessment center. So the testing at an assessment center is called a PCR test, and that is the one that is the confirmation test. So the rapid testing is just a screening. It's considered a presumptive positive. But the next step would be to go to get testing at the assessment center. I'm just pulling up the percentage. I don't have the actual percentage, but the sensitivity and accuracy is not 100%. There's a strong possibility of false negative results. And that's really why we emphasize that rapid testing is one additional preventive measure, but that you need to maintain all of the other preventive measures. I know there are percentages. I would have to look them up. It depends on the type of rapid test, if we need that specific percentage.
Thank you, Crystal. Just for everyone's information, the Ottawa Board of Trade and the province of Ontario are distributing the PanBio test from Abbott. And I believe that the accuracy is only 80%. So as Crystal said, this is only a secondary layer of protection for you. It does not replace PCR testing in any way, shape, or form. Our next question I'm going to throw over to Jenny. So cloth masks are not to be used if one employee is within 2 meters of another employee, even if it's for a 5-minute conversation. Is that correct? Or is it meant to be if their permanent workspaces are less than 2 meters apart with no barrier?
Thank you. So it is meant all the time. If there is to be any occasion where one or more employees will be within a workspace that does not allow for 2-meter physical distancing or a physical barrier, they must have a medical grade mask, as opposed to the traditional cloth masks that we've all become more accustomed to.
Thank you. Next question, I think, is going to go to Kayla. Is there a limit on patio capacity other than the 4 per table and 2 meter distance to table?
So unfortunately, it is challenging to say with certainty what the rules will be without them being published. As we're all aware, they've changed frequently. At this time, all we know is the 4 per table and 2 meters apart. So again, without seeing the regulations, it would be hard to say, but I imagine it would be based on the ability to separate those tables.
I'm going to go out of order a little bit in the questions because one of them is a natural follow-up for Kayla. For the 4 people per patio table, is it same bubble only? Do we need to put on the shoulders of our 16-year-old hosts and hostesses this kind of policing?
Again, without seeing the regulations, I know that's not helpful and I can't really answer that without seeing the regulations. There's no indication of what the 4 people will be. If it's similar to the past, it would look to be the same household members. But again, without the regulations being released by the province, we cannot say with certainty what it would be.
Thank you. I'm going to ask Jenny to answer the next question, which I believe has already been done. It's a little hard sometimes to listen while you're trying to monitor all the chat, but I think it bears repeating. What are the approximate dates for step 2 and step 3, please?
So when we're looking at the different steps within the provincial road map, it is all going to be determined based on a minimum of 21 days. So June 12th is the beginning of step 1. We will be in step 1 for a minimum of 21 days, pending those various indicators that Kayla was speaking to. So they're looking at various health indicators. What are the levels of COVID within individual health units as well as the province as a whole? What are they seeing in terms of the variants, hospitalization, and of course our vaccination percentages are another big factor.
Thank you, Jenny. Next question, can takeout be clarified? Does that mean you're allowed to walk in and order at the restaurant? And I'm going to ask perhaps Kayla to take that one.
So takeout, I assume that means in a small restaurant that you'd have to go in. I believe that would have to be ordered ahead of time. So calling in, ordering it, and then picking it up. But I can defer to Roger Chapman on that one to confirm.
Yes, good afternoon, everyone. For situations like a Subway or a Pizza, those type of places, obviously the walk-in, order, and take-out is permitted. It's the dine-in privileges that have been restricted.
Thank you. Going back to our questions. Last summer, we were allowed to offer outdoor yoga classes with social distancing, pre-registration, and a maximum of 20 people. Do you know under what stage will this be allowed to occur? Kayla, is that something that you could answer for us?
Yes, for sure. So sports and recreational fitness facilities, I'm just looking at my other screen here for the roadmap, so apologize for that. Outdoor team sports and training with 10 people will be permitted in step 2. And then in step 3, that would be outdoor sports leagues training for professional athletes. And so, sorry, for fitness classes as well, the 10 people maximum would be step 2. So 21 days after June 12th to 14th.
Okay, thank you. Next question, I'm going to ask Crystal to take this if she can. It is my understanding that day camps will open in step 1. However, we have not received any particulars on this within the new guidelines. Do you know when this will be released?
Yes, hello. Don't know for sure when it's going to be released. So what we are hearing from the province, they said mid-June. And I also understand that Public Health Ontario will be facilitating a webinar to align with that guidance for summer camps. Again, hearing mid-June, but don't have confirmation on that.
Thank you, Crystal. Next question, I think we'll go to Kayla. At my workplace, some employees do not always wear a mask or physically distance. Patrons have complained, as have other staff. The owners also work there and do not adhere to mask wearing or distancing either. What should be done?
So in instances like that, I would encourage people to call 311 and we can have an officer dispatched to investigate that and follow up as necessary.
A nice simple answer. Next question, and I think this one will go to Roger. Is it still permissible for employees or customers who have medical conditions or disabilities to be exempt from wearing masks?
Yes, again, without the new regulations being released, you know, to answer with certainty, it's difficult, but certainly throughout the pandemic and the regulations that we've experienced, that medical exemption has always been there. So I would suggest that it will continue. We always encourage people that you know, have difficulty wearing a tightly fitted face mask to find other ways of protecting themselves and others, including you know, if they're able to wear a face shield and still be able to breathe properly, then we would suggest that that's an alternative that could be used.
Thank you. Roger, I actually have a great follow-up question for you. Do customers who say they have a medical exemption, are they required to provide proof?
No, so proof of medical exemptions are not required.
Great, thank you. Next question, I think will be directed to Jenny. Is the 3-meter distancing gone for inside fitness and yoga classes?
So excellent question. Again, we're going to sound a little bit like a broken record here, but until we see the new regulations for step 1, 2, and 3, we just can't answer that question. The 3 meters previous was in order to create additional space because of the amount of activity that was taking place in those facilities with the individuals who likely would not have been wearing a mask at that time during the physical activity either. So we could look that there would be a likelihood that that increased distance would continue, but again, we can't speak to that until we see those regulations.
Okay, thank you, Jenny. I have another question for you, Jenny. Do we know when indoor pools can be opened again to guests?
So indoor pools at this point in time, and Kayla and Roger, I will let you confirm just to make sure that I've got this right, will be available in step 3. That outdoor pools and beaches can open sooner than that, but indoor facilities don't begin until step 3.
Okay, thank you. This next question could be answered by Kayla or Jenny. Do we know when the regulations will be released by the province?
Rock, paper, scissors?
If only you had a crystal ball.
Unfortunately, again, we're a broken record, but we've had no indication as of yet when we would receive those, unfortunately.
Thank you. This is a great question because I think everyone is interested in having this absolutely clarified. Based on what I have heard, should I assume that all retail employees would have to wear eye protection and medical grade masks, as there cannot be protective barriers between staff?
I would say that that is likely the simplest approach for many retailers. I do know from chatting with some of my colleagues in recreation and facility services with the City of Ottawa that that is what they are looking to also have for, you know, their summer camp programs and other programming, is for all employees to just have their masks and their goggles.
Thank you. Next question, perhaps to Jenny. In an office setting with employees sitting in cubicles that are over 2 meters apart, are employees required to wear masks? Currently, employees do not wear masks in their cubicles. However, as soon as they leave their cubicle, they're required to wear a mask. Would this protocol still be following the new regulation?
Yes, assuming again that the cubicle spaces met the physical distancing requirements and or had some type of physical barrier between them, the staff, while in their cubicles, could remove their masks and goggles or eye protection. If they're getting up to go and have a conversation with someone in their cubicle, then they would need to put on or don their appropriate PPE. Similarly, depending on the space, in hallways or thoroughfares within the workspace, if they're likely to come within less than that 2 meters of physical distancing, then they're going to have the appropriate protection at that time as well.
Thank you. I have another question for you, Jenny. And David, if you're still on the call, perhaps if clarification is required, I'll get you to unmute and elaborate. Is there a way to voice opinion for indoor fitness to allow for only 2 meters physical distance if a mask is also worn?
So those types of regulations, restrictions, or lifting of a regulation or a restriction comes at the provincial level. Certainly, Ottawa Public Health does have the capacity to increase requirements based on what we're seeing within a local context, and you've seen that in various Section 22 class orders, but we do not have the ability, it is not within our scope to decrease whatever the province puts forward.
Thank you. Crystal, I'm going to call on you to just sort of voice out loud your follow-up to the day camp question, please.
Sure. I'm just realizing I didn't actually attach the link to my comment there. I thought I was sharing a link to the summer camp guidance that the ministry produced last year. And I'll make sure the link goes in there, but it was really, we are anticipating there will be amendments to that guidance. But if you are doing planning for summer camps, we would assume and anticipate some of the public health measures would be the same. So it would at least give you a starting point for your planning in terms of what measures you want to be anticipating. And then when the update comes mid-June, you might just have to refine.
Thank you, Crystal. Jenny, I'm going to give this next question to you. So just to make sure that they heard this correctly, fitness class and yoga can resume in stage 2. It looked like it was stage 3, but they like stage 2 better. And Jenny, maybe you could also elaborate a little bit if there's differences between indoor and outdoor classes.
So there's absolutely a difference between indoor and outdoor classes. It's the outdoor activities that will be able to resume in step 2, and then the indoor facilities in step 3. And as we know, it's because the outdoor allows us often a greater space for physical distancing, but also the airflow makes a difference.
Great, thank you. Kayla, this one's going back to you. Step 1 allows non-essential retail to be open at 15% capacity. Essential retail increases to 25%. That implies that essential retail settings are safer than non-essential. Is it your feeling that essential retail is safer?
Unfortunately, I mean, these regulations are put in place by the province. I wouldn't be able to speak to what would be safer or not. I mean, that would be more a health aspect, but even then, you know, this is a provincial decision. Yeah, sorry, I can't really answer that one.
Not an easy question to answer.
No,
is it?
not at all. I understand for sure what's being said, just it's a provincial decision,
Yes.
so it would have to be addressed by them specifically.
Absolutely. So I see that we're just at 2:01 and we have 2 more questions that have already been posted in the chat. So being respectful of time, we'll end it there. But certainly if you have additional questions that haven't been answered, you can send them to me and I'll make sure that Ottawa Public Health gets them. So Jenny, this question is going to you. Does the mask and goggle change apply to all different kinds of workplaces and not just businesses? They are specifically thinking about nonprofit organizations.
So based on how the Ministry of Labor has written the requirements, it is for all kinds of workplaces. I can't unfortunately speak to how that would apply to a not-for-profit if everybody within that space was a volunteer from a regulation standpoint. Certainly from a public health measure standpoint, we would advocate for the strongest best practice measures be put in place. And I'm just going to skip because I see it down a little bit further, Lynn, is that there's a question, is the eye protection going to be a new requirement in stage 1? So the eye protection, again, is Ministry of Labor related, and it is enforceable immediately. So it's not linked to either stage 1, 2, 3, or even the pre. It's required immediately.
Thank you. And perhaps somebody at OPH can post a link to guidance on the types of masks that are required if that hasn't already been shared. And I just want to remind all of our guests that we did record today's session. Sometime this afternoon, I will have it live on our website, at which time we'll send an email out to all of our registered guests with a link to the recording, so that you can rewatch it again if there's more information that you would like to have. And on that note, I am going to wish you all a safer reopening of your business. Thank you so much to Ottawa Public Health and to Bylaw for taking the time to answer everyone's questions today. And of course, a huge thank you to OCOBIA and RGA for being our community partners and getting the message out about these wonderful workshops to as many businesses as possible. So it is a chilly day today, but it's absolutely lovely. So I hope you get a chance to safely go outside and enjoy some of this beautiful sunshine. And thank you very much for taking the time to join us today. Have a great afternoon.